Hello, everyone, and welcome to Esperança Surgical Stories on this great Tuesday afternoon. Thank you so much, everyone, for joining us. We're super excited for our session today, and we have two awesome guests with us. Right now, we're waiting for the second one to arrive. Hopefully, she doesn't have connectivity issues and she can join us shortly. But for now, I wanted to introduce everyone to Dr. Kimberly Spahn. She is based in San Diego, correct?
Mm-hmm. Yep.
And I'm going to let her talk a little bit more about herself, but we were just catching up right before this. It's been so nice to see your face. We haven't seen each other in person or otherwise for like 3 years, so it's so nice to catch up and get a little bit one-on-one time and hear about how this recent surgical trip went.
Yes. Well, it's so good to see you. And yes, it's been way too long. Hopefully we get to see you in person soon again here in a little bit. But yes, we just got back from Ecuador and it was so great to get back there after the pandemic and all of that. So I am based out of San Diego. Right now, my practice is primarily pediatric orthopedics here in San Diego at the Naval Medical Center, San Diego. But I was recruited about 3 years ago, I think in 2019, to start going down with Esperança to Ecuador with Dr. Sachs and his team. And now this was my third trip down there. So it's been great.
That's wonderful. And tell us a little bit about what role you play when you go on these trips. What does it look like from your perspective?
Yeah, so I'm one of the pediatric orthopedic surgeons. So my role down there is to not only help indicate patients for surgery when we first get there, after when we see our clinic, but also then actually do the surgeries and as lead surgeon in some of the rooms that are running. We've been lucky enough to bring multiple pediatric orthopedic surgeons down as the primary patients that we take care of are pediatrics. So I basically take on the role as lead surgeon for one of the ORs that are running. I think we've run a max of 3 ORs, sometimes only 1 to 2.
Oh, that's awesome. Could you tell us a little bit about how you even got started? You mentioned that you were recruited about 3 years ago. So what were you looking to do some sort of service like this, or how did that even pop into your head?
Absolutely. I'm a Loyola girl through and through, educated by Jesuits. So service has always been a big part of my education. And then when I went to medical school, also Loyola, I was fortunate enough to be a part of a few medical trips when I was in medical school. And then completed residency, decided to join the Navy because I wanted to serve, and ended up kind of putting a lot of the service on hold during residency. And then when the opportunity presented itself to do a service trip, it was a little bit difficult for me because I am the only pediatric orthopedic surgeon for the Western Fleet. So it's I'm not really eligible to always go on the service trips that maybe are sponsored by the Navy. So when Dr. Sachs had approached actually one of my former Navy colleagues about possibly taking a week and going down, that's something that I could definitely do, taking a week away from my practice. So I was very excited and was able to go down to Ecuador. I jumped at the chance as soon as he asked me to go. And our first trip was definitely a little overwhelming because I don't think any of us anticipated how many children we were going to be seeing. I think we had thought maybe it was more a mixture of adults and kids. So it was quickly very clear that we were going to need more than just one pediatric orthopedic surgeon to come down on these trips.
That's awesome. First of all, thank you so much for your service. And I think it makes it extra special because it's like double service. Like not only are you actively in the Navy, but then you still volunteer for all these other things. And I don't think there's a lot of people like that. So thank you so much for all of your service and for continuing to support the work that Esperança does. And I do remember that first trip to Ecuador. I think it was a little overwhelming for all of us because we were kind of caught off guard a little bit as to how many pediatric cases we saw, but I do remember seeing you just kind of get into surgical mode and be like, okay, this is how we're gonna do it. And you broke it down and we had a plan, and it kind of set us off on the right trajectory. And then we've had so many successful trips to Ecuador since then. So with that, can you give us a little insight for everyone here that maybe has not been on a surgical trip? Like, what is the day-to-day like? What could they expect if they went on one of these surgical trips?
Well, I always tell people it's a very rewarding experience, but it is not a vacation. So, we get there. The first day is a massive clinic. I think the first year we were there, Anna, I think there might have been like over 200 people for us that first day that we were there. This last trip was a little bit less, but I think we've started to get the hang of screening a little bit, the pre-screening that goes into before that we even get there. So the first day is a just massive clinic, anywhere from 150 to 200 patients, I think has been the numbers we've seen. And then based on that clinic, we indicate patients for surgery for the following week. And then the week is basically Monday through Friday, and every day is an operative day. And we look at the amount of ORs we have and the amount of surgeries that we do, and we prioritize and try to get as much as we possibly can done, knowing that we're going to probably start at 7:30, 8 o'clock in the morning and probably run till about 6 o'clock at night, depending. Sometimes earlier, sometimes later, just depending. But it's a marathon of a week for sure.
So tell us a little bit about the more common cases that you see when you do these trips.
So I think, a lot of the pediatric cases that we encounter, I will say the majority of what has been brought to us when we are in Ecuador is our club feet. I think the neglected club foot is something that we've probably seen the majority of cases when we're down there. We also see other congenital issues like congenital hip dislocation or dysplasia of a hip. We also see just deformities in general, things that are congenital or otherwise acquired. We've had a few missed fractures that have malunited, and then they have come to us for osteotomies. And then we've had other congenital issues such as, very severe bowing of the legs or very severe knock-kneed position of the legs that we've done surgeries on.
How are these different from the more common cases you see here in the States?
Mm-hmm. So, in the States, we have a very strong screening program for hip dysplasia. It's pretty well established, and people have pretty good access to care to get ultrasounds for babies, have good exams, and then the correct intervention, have ability to get these babies into harnesses very quickly. As far as club feet go, babies that are born in the States will see a pediatric orthopedic surgeon for club foot treatment anywhere from 2 days after they're born to 6 weeks after they're born, and initiate casting. And, as much as the Ponseti method, which is the most accepted method for treatment for club feet, as much as it's just casting, yes, it is a technique and you have to have certain skill to do it. It seems so simple, but when you're in a country where you may not have the person that you can see every single week, which is the process for this, these casts have to be done every week. You have to have the casting material and you have to have someone that can actually do it. The transportation, the ability to get these supplies, the ability to have a skilled person do these, it's not very easy to do in a system that's not set up for this. So we see a lot of the neglected club feet just because they don't have access to either someone that does club foot casting, the materials, or even the follow-on care, which is also just as important as the initial casting. So I think it's a combination of just access and then having the materials even.
Right. So it sounds like in order to prevent some of these neglected clubfoot cases, we would have to remove some of those barriers, a lot of those barriers to access to education, potentially for parents to know how to spot it early on, and then supply logistics of getting the necessary supplies and the necessary human resources to apply that, right?
Yep.
That's good to know. It gives us some homework to work on, I think.
Yeah.
Excuse me. Tell us a little bit about what are some of the responses from the families that you saw this last time? when they come out of surgery, or even when they first meet you? What is that interaction like?
So, I think there's always that, it's always very humbling to work on these missions, and the families are all so grateful. And these are parents that are just trying to do the best possible thing for their child, as any parent would want. And they are extremely grateful for what Esperanza is able to do on these trips and the surgical teams. I have had, I've cried with them. I've been extremely humbled by these parents. I think the hardest part is, when there's people or when there's babies or children that are brought to us that we just can't really help while we're down there. And I think just due to lack of resources or lack of follow-on care, or it's just really not something that we can fix, like cerebral palsy or things like that. But I think even just the ability for the parents to know that they brought their family member or their child to a surgeon for help, to see if there is something that they can do. I think that as much as it's the hardest part of our job is to tell them that we don't have a way to help them, I think it still is extremely important for them to have access to people like us that can actually have that conversation with them. In addition, when we are able to help these families, like I said, is extremely humbling and a wonderful opportunity for us to be able to use our skills to do what I love, to help someone. It's wonderful feeling. I'm selfishly, I think, more so for me, but I am also super grateful for how wonderful these families are, because when we leave, a lot of the work then begins for them, especially with club feet. It's not as simple as just a one and done. A lot of times when those casts come off, it's then compliance with bracing, and these families, they do such a good job, and they want so much to do the right thing for their kids. And so it's been a extremely rewarding experience to work with these families.
That's awesome. I love that. And I think a lot of us that have been on these trips are a little guilty of that selfishness of, I want to go because it makes me feel good.
Yeah.
And it's not a bad thing, right? Excuse me. I think Denise is trying to join us. I'm trying to get her to pop in as a panelist, but it's not. There we go.
There she is.
Hi, Denise.
Hi. I don't know. My camera is not working or something like that.
Oh,
I don't know. Because I see you both, but I don't see that my window is there.
yeah. Well, we're glad you made it. We're glad you're here, and thank you so much for joining us. We already kind of got started with some questions with Dr. Spahn, but I wanted to give you an opportunity to introduce yourself to everyone that's on this webinar. Tell them a little bit about yourself and how you ended up partnering with Esperanza.
Well, it's a very long story, but I can try to make it little. So I began helping the hospital that we are working with because my son, my youngest, he was born with club feet. So I knew that missions were going there. So I heard about it and I went there and I offered any help that they may need because I knew English. So they start getting my help to many missions. And one of those were yours and you came here. So when they knew that you were looking for a coordinator, and I was studying public health too. I'm still studying public health. So they said, it's the perfect person. Denise Palma is the person that you need there. And she has been here helping us so much, and she knows everything about coordinating things for the mission, for all the missions now. So then I started there, and I have been enjoying it so much. I really love it because it was just a service at the beginning, and now I'm hired, and I was like, oh, I love it. It's like the perfect thing that ever happened to me. So I'm so happy, and the teams and the people that is coming, all the doctors, it's just great people. I have it. I feel like they're kind of like my family that come here and visit me for a moment, and we have them for a week, and I really feel like they're my family. So it's such a nice experience.
Oh, that's so wonderful, Denise. Thank you so much for sharing that. And I thank you for sharing your story too, because I think that's such an important piece of, why we work so well together, because, you were once in the patient's shoes and with the family's shoes, right? You were on that side of the table where your child is the one that needs the help, and you're put in that position of, I want to do everything I can to help them, and therefore I'm gonna, go to this hospital and put them in the hands of these American doctors. So tell us a little bit about that, not just from your perspective, but all the patients that we see during these trips. What are the kind of factors that affect the patient's ability to seek this care? Why do they have to wait until there's a mission to seek this care?
The good thing with the career that I am studying is that I can see many perspectives. One of them is that I think that many people that live in rural areas, they don't get the chance to go to the city every time that they need. So they leave the children that way until, I don't know, they just hear how they can help them, and maybe they take some action. In other areas, the people who live here in the city, there are many difficult chances to get help because, for example, and in the hospital that I went with my baby, they ask for you have to pay every week so they can give the cast to the babies. And there are many people that they don't have the money to pay every week to make those casting. So that's one of the things that I have seen also with people that they don't have the money. They just can't go to a treatment. And the treatment that you get from the government, because the government gives public health, right? But it's not the best one. It takes so much time for somebody to get an appointment. And after they get appointment, okay, they start with the casting. But I heard patients that came to our mission that they cancel their surgeries like 2 or 3 times because things happen. And I don't know why, but the doctors here in our government, when they are hired from the government, it's kind of like they're not very dedicated to patients. It's just like a job that if they don't go, okay, they don't go. And if they go and do the surgery, it's fine. So it's something like that. And that's the difficult part. So that's why when they hear about Esperança that gives the surgeries, they run, they just desperate go and get the help because they are no other way that they can do it. Because also they pay like $200, $300 or $400 for a surgery. And when they have come to the mission, they said that they already had one surgery, but I don't know why it didn't work. That's another thing interesting, that it didn't work. And so Dr. Spahn can know more about that. Mm-hmm.
Yeah, it's interesting because you're pointing at some of the barriers, right, that patients see from their end. And I think right before you jumped on, Dr. Spahn and I were also talking about some of the remaining barriers for patients seeking this kind of care. So I think that's one of the key aspects of Esperanza's surgical program, is that we help remove those barriers so that those people who need it most, who have been waiting the longest, who have been putting it off, who just can't afford it, they get a chance to get this essential surgical care, and that a lot of times changes their lives. And I wanted to talk a little bit about that. We're going to take turns speaking a little bit about what kind of impact does that have on a child's life, specifically talking about clubfoot. But any of the types of surgeries that we've done on these trips, like what does that mean for that child growing up? Dr. Spahn?
So I think, we in the States, we don't really see a lot of children walking around with neglected club feet. It's pretty rare. But what you would see, what we encounter in Ecuador, are inability to just wear shoes. They can't really even wear shoes. And some of them will eventually lose the ability to walk. Sometimes, depending on how severe the club feet are, they can continue to walk, or, you know, kind of crawl, use crutches to walk. But, you know, it's something from as simple as just the ability to wear shoes to something as extreme as even just the ability to walk. And eventually they will lose the ability to walk because our feet aren't meant to bear weight in that position. So, you know, I think the impact when you really sit back and think about it is incredible when we are helping kids have the ability to walk.
Denise, do you have anything
Yeah.
to add?
What I have seen also that is that parents are like so grateful because they feel that they want their children to have normal feet. They want them to be as a regular child, walking, running. So families get so happy and they get so grateful. They always saying, oh, thank you so much. You changed my life. You changed our lives. And my son is now able to have a regular life, with, you know, and those things are the ones that I think are the most rewarding ones, because they cry. So sometimes they're crying and saying thank you. They're crying and saying thank you, that God bless you, and things like that. And that's one of the things that I think are very, very nice to hear from them.
Yeah, I'm sure. I think of just the ability of the parents to, you know, if once the child has this surgery and they can start to walk properly and maybe even without assistance, then the parent can potentially focus on other things, right? Maybe even get a job outside of the home because they don't have to be at home taking care of them 24/7. So I think, and from my perspective, also thinking of public health, it kind of just opens a whole other range of options and possibilities that weren't there before. So I think the impact, you know, I like that we kind of covered like micro to macro. It kind of goes from that child and what that does for that child's potential all the way to the family and what that can unlock for their future possibilities. So tell us a little bit about a moment that stood out to you during this last trip. Denise, I'm going to start with you. So was there like a moment during the week that you were like, oh my God, this is why I do this. This is why I'm here.
Well, I couldn't say that it's just once, because like every day we see the people that are so excited. They're scared at the same time. It's like too many emotions that they go through, and we can get involved in that too. And well, I would always say that when parents are like, they get like a little scared for the surgery, and I'm like, why are you crying? I always tell them, why are you crying? And they say, well, I'm a little scared, but I'm happy that he's having the surgery. So you are doing what is right. You have to be proud of you because you take your children to the right place, your child, sorry, and they are getting treatment. So you don't know. I tell them, you thousands of surgeries I've seen, and they are so well done. So don't worry, get a coffee and come back in a month. and they start laughing, and I like that. I really like to give them like a relax, even though they feel anxious and all that. They make me feel like I'm kind of like the clown there a little bit. make them feel happy and just laugh about the negative feelings. No, just forget about that. And then they come so happy. And I think that's the things that I like the most, when they get their children after the surgery. I think that's the best moment of the whole thing, when they call them to see the patient, and the doctor explains them that everything went well, and this is the procedure, and this is what you have to do after that, and everything is going to be perfect following those things. And they are so like happy. They have glowing faces, something like that.
That's awesome. Yeah, it's very important to to keep the morale up, right? So sometimes playing that role of the clown or the, you know, happy go jolly.
Yeah, I didn't know how to say in English.
Yeah, it's very important. It's very important because otherwise parents just worry and get anxious, and that energy is not helpful to anyone. So that's awesome.
That's true.
How about you, Dr. Spahn?
Yeah, just to reiterate what Denise was saying, you know, I think having her with us is such a valuable asset because she has been on the other side of this as the parent. And so I always grab Denise when I'm done with surgery. I'm like, let's go talk to mama, you know, let's go talk to the parents. Because I know Denise will calm them and let them know everything's going to be okay. And, you know, it's such a great perspective to have someone that's been in that waiting room before waiting for their baby to come back out to them. So I think that's one wonderful reason, one thing I always think about. But also, you know, a lot of these are babies that like Denise had said, they really want their foot to look normal so they can wear a shoe and, you know, so that the kids don't feel that something is different about them. And so I think for me, you know, when we take these kiddos' feet back that are, you know, curled under, and we give them back to mom and their foot straight, and the mom, those are always the, you know, the moments where they're just so excited to see that and see that something has been done, you know. And it is not always the way that we would necessarily want the treatment of clubfoot feet to go. You know, we don't really want to do these big surgeries on kids. But I think in a situation where we just don't have access to the repetitive casting that we need, this is the best option in a situation like this to get those kids at what we call a shoeable foot, something that they can put a shoe on, something that they can weight bear on in a normal fashion. So that they can play a sport if they want to, they can walk without assistance, they can get a job when they're older, you know, all of these things, where it may not be, you know, the thing we do all the time, but it sure is pretty nice to give the baby back to mom and dad and their foot straight for them. So.
Yeah, I can't imagine that feeling. And we actually have a question from Stephanie that kind of relates to what you were talking about, so I'm just going to go ahead and read it. She's asking if there's any age limit for older children or adults to get their hip dysplasia or club feet corrected.
That's a really great question. You know, Ponseti, who gave us the Ponseti method, Dr. Ponseti used to say that you could do Ponseti casting upwards to age 10. You know, I think in the perfect world, we would always start with casting, and we'd always start with seeing what kind of correction we could get with casting. And then it minimizes the surgery that you have to do. And studies have shown that the less surgical aspect that you have to do to a club foot, probably the better. So it definitely, we would love to cast these kids, but we're only there for a week. And when you look at what they have available to them, what resources they have available to them, it's either do nothing or try a surgery that has also had, you know, many years of data. In fact, on our last trip, we had Dr. Nancy Miller, who she is one of actually my mentors, and also she's at Colorado Children's Hospital, and she's part of many different research teams. She's very well published, and she has a very strong interest in club feet and actually trained under Ponseti himself. And she was telling us how this was, you know, the surgeries for club feet were what we did before we had the Ponseti method. And so, you know, this is definitely something that you can do all the way into adulthood, and some club feet you are chasing into adulthood. And so as much as we would love to cast these kids, it just really isn't the option down here. As far as dysplasia goes, you know, it's very interesting. We would love, if we can catch a baby before the age of 2, we can intervene with bracing. We can intervene with some sort of Pavlik harness or an abduction orthosis. And but again, it's screening those babies and catching them by that time. So a lot of these kids that come to us are a little bit older than 2 years old. And so for those, we do have to do surgery. And, you know, hip dysplasia surgery is done all the way into adulthood as well. The surgery just changes as they get older. And then a lot of it depends on if as they get older, if osteoarthritis has developed, because if that happens, then you're looking at putting off surgery until they're ready for like a total hip arthroplasty. That's one of the reasons why we're so aggressive with hip dysplasia, because we know that the hip will eventually wear out when it is not reduced or if there's dysplasia. And the only option we really have at this point for when we lose our cartilage are hip replacements.
Wow. Yeah, so we can understand why, you know, it's best to catch these and prevent, right, as much as possible at early ages rather than
Absolutely.
wait to do the extreme surgeries. And I think you've touched a little bit on this, but I wanted to explicitly ask, what were some of the challenges on these recent trip, and how did you overcome them?
Mhm. I think, you know, surgical selection is always a challenge. I feel like, you know, just because you can do something doesn't always mean you should, especially when we don't know always what the follow-up care will be and what resources will be available. So I think really making sure whatever surgeries we do take on, that we are thinking about what kind of follow-up these children will have and what kind of access to different resources such as braces or in the case of a lot of the surgeries that we did, making sure there's an orthotist who is skilled that can get them braces to sustain the surgeries that we've done while they continue to grow. So I think that that's a huge challenge, is leaving, knowing that you're only there for a week and you want to make sure that the surgeries that you've done have not caused harm and that we're doing something that will continue to benefit the child. So I think those are always a challenge, is really making sure. And I think that's where someone like Denise is so important, because really making sure that follow-up care is done appropriately. You know, because without that, a lot of these surgeries we shouldn't be doing them unless we know that they're going to be getting good follow-up care.
Right. Denise, from your perspective, what are being the liaison, right, between the families and the surgical teams? What are some of the challenges that you overcame this last trip?
Challenges between families and doctors, is what do you mean?
And just in general, because you have a special role, you know, functioning between the two, right? Communicating between the two groups. So what were some of the challenges just in general that you faced?
Well, I haven't seen a challenge. Maybe only a barrier could be the language, but with the translation and all that, everything works very well. Maybe a funny thing that I have seen, probably, it's sometimes the cultural things. For example, we have the idea in our country that when you get through a surgery or you get a wound, whatever, you cannot eat peanuts, you cannot eat chocolate, you cannot eat certain stuff of, I don't know why, because my parents were not from Ecuador, so I just heard about that. And they are asking all the time, can he eat everything? Can she eat everything? I'm like, yes. Well, the doctors over there, they have no evidence about those things. So, but if you feel comfortable with that, just go ahead. But nothing's gonna happen. The wound is not getting infected because he got peanuts, things like that. So it's kind of funny that area. I could say that maybe it's a little challenge, but I won't say that it's a challenge. It's just a difference of cultural things, is what I think.
Yeah.
But that's the only thing. I haven't seen any other challenge like that.
That's a great point, though, and I think sometimes we downplay the importance of culture when it comes to these trips, but it's such an important piece, and it's so nuanced that sometimes we can overlook it, but it plays, I mean, as Dr. Spahn was saying, you know, the follow-up care is so important, and at this point, you're handing the patient back to their parents, and it's in their parents' hands to take them to the follow-up appointments and you know, do the proper care at home and the cleaning and all that. And that education piece, there's a big cultural component of that patient education, right? So I think and that's why the role of Denise is so important, and that's why it's part of Esperanza's model to work with someone that's from the community that can relay that message as best as possible, because you know, you don't want to put all this effort into a surgery that then doesn't have a positive outcome just because follow-up or miscommunication or misinterpretation or anything like that, right? So we're doing everything we can along the entire path to make sure that we have a positive outcome.
Yeah, and also the hospital does a great work because they call them to come back so they can check the wound with the doctor that they have here in Ecuador, and he does the follow-up, and that's so good because they start getting a follow-up also, and like in the hospital, Allison and other people there do wonderful work in that too. So I think that it's a great job.
Yeah, they do a really good job at patient outreach and sticking with the patients, right? I don't think that all hospitals do that, so I think that's really admirable from our partner hospital in Ecuador. We have another question from the audience for Dr. Spahn. What would you say in a priority list sense is the biggest need for the next trip?
Oh gosh, that's a great question. You know, Dr. Sachs and I had talked a lot about this. You know, I think we had fallen quite behind with not being able to go during the COVID pandemic, and Ecuador was hit extremely hard by the pandemic. And so we had quite a backlog of patients. And so when the trip that Esperança went on in the fall, really, they had to leave a lot of people for our trip that we went on. And I think that that's actually such a wonderful aspect of Esperança. And one of the reasons why I continue to work with Esperança is that for me, continuity of care and being able to say, hey, come back and see us in 6 months when we come back again. That means so much as a surgeon that's very protective of my patients. I love that we have that continuity, that we're going to the same hospital with the same group, with Denise, and the ability to contact these patients and make sure that we're getting that. So I think, you know, we left behind even some things we weren't able to get to the last time we were there, just because there has been such a backlog. So I think, you know, again, we're going to be seeing a lot of club feet. And I think one of the wonderful things that we've done to try to look at long-term outcomes is we've established with an orthotist down in Ecuador who is helping to make sure these kids have the right braces. Because I think one of the bigger components here is seeing if we could do some sort of prevention, seeing if we could do some sort of early treatment with casting. And so maybe training people like Denise, you know, down in Ecuador, to, you know, even training them in how to do a Ponseti cast or how to get a Pavlik harness on a baby. You know, I think that these are all things that we can start looking towards prioritization in the future once we kind of get through the backlog of patients that's been waiting since the pandemic. But we do try to, when we're there, we do prioritize some of the big hip surgeries, I feel like, because those, they take a lot of time. They take one surgeon and, you know, an assistant, and it's a long surgery in Ecuador. And then it's also a spica cast afterwards, which adds on some time, and the care that goes into those kids is quite a bit, and makes us all very nervous leaving them in Ecuador. We don't love leaving our patients like that. So we tend to do those patients earlier in the week just to make sure that we have the resources available for them. And so I think, you know, there's probably a few hips waiting for us when we get back down there that we need to address. Certainly the second side of surgeries that we did, maybe the first side while we were there on this trip, and then the kids are ready for their second side. So I think all of those will be, you know, components that we will prioritize the next time.
Thank you so much for that. And I did want to close out with a remark and followed by a couple questions. So the month of May is recognized as Women's Health Month, where the goal is to empower women to make their health a priority and help women understand what steps they can take to improve their own health. So with that, what does it mean to you to be a woman in the healthcare field, and undoubtedly impacting so many other women along in your journey?
Well, I definitely, I'm very, very proud to be a woman in my field. I think orthopedic surgery, unfortunately, is one of the specialties that just can't quite make it to that 50% that the other the other specialties are. I think we've still been about 6% women in our specialty, and it really hasn't changed. So I find myself surrounded with some good company. The last trip we had 2 other female orthopedic surgeons that were on the trip. It was pretty impressive to be with those women. They're just incredible, talented, amazing people. So, you know, I'm humbled every day by being able to do what I do, and hopefully show other women that they can do this too. And then as far as women's health, you know, what I do as a pediatric orthopedic surgeon is so tied to prenatal care and access to prenatal care. I think that, you know, half of the things that we see when we're in Ecuador are usually caught on a prenatal screening ultrasound. A lot of what I do is prenatal counseling when babies are diagnosed with club feet, which is picked up on an ultrasound, or other congenital disorders that are picked up on an ultrasound. Lack of prenatal care can also lead to higher incidence of cerebral palsy due to birth trauma or issues during birth, and just access to care for these women. It is very much ingrained and related to what I do as a pediatric orthopedic surgeon. So, you know, I think that for me, the more we can benefit women and women's healthcare worldwide and get access to care worldwide, including prenatal care, the less club feet I'm going to see, the less dysplasia that I'm going to see, cerebral palsy, all of that. So I think that it is so hand in hand and so important. And that's why right when we were starting, I was just asking if Esperança is looking at doing any sort of outreach for screening for women, women's health, because it is something that it needs to be a better priority.
Thank you. And Denise, you know, you mentioned you're studying public health. This is something that you're very driven by. And now that you're working in this as a surgical coordinator with Esperança, what does it mean to you to be a woman in the healthcare field?
Well, I really like it because I'm a frustrated doctor. I just got 6 months of medicine and things happen. My dad didn't have the money to continue paying and things like that. So now, like doing all these things, it's like something that I have in my heart, in my mind. It's so stuck in, and I feel like the mother chicken and mother hen, we say. I don't know if that makes sense in English, but la mamá y los pollitos, we say, like the mother hen, and I just feel like I have like a family. It's like a little family that we're all together, and it's like a woman power. When I see all the girls in the surgery room, like talking about what they can do in this case and the other, it was like I have seen like the power. How do you say the cartoon with the Powerpuff Girls, something like that.
Yeah.
It makes so it's so funny, and it's nice because women have their natural I don't know, genes things that we want to take care of people. I don't know why we are like that. Women are like that. So taking care of more people than my children is something like it fills my soul so much, and having the same feeling with all the doctors and you know, Dr. Spahn. It's such a nice feeling. I think it gets like a very positive energy around the whole mission, something like that, that it's so beautiful. I cannot compare it with anything else.
Well, thank you both so much. That was awesome. And we actually do have one last question from the audience, so I'm going to steal a little bit more of your time. From Erin, are there any resources available to them for follow-up physical therapy? So do these patients need physical therapy? If so, how much? And do they have that at the hospital?
So Denise, I might actually ask you about this part, but I mean, for the surgeries we do, again, there are certain surgeries that we would really love to have physical therapy, specifically with getting kids used to walking in a AFO, which is a ankle foot orthosis. It's a brace that kind of goes from right below the knee in the back and down through the foot to kind of hold some of the correction that we do for these surgeries. And a lot of times here in the States, we would send these kids to physical therapy afterwards. So I would actually, I did have one patient go to physical therapy after our first mission but I'm not really sure what kind of access they have. The good news is a lot of the surgeries that we do, we try not to have as much dependence on physical therapy. But if we have the ability to get them to a good physical therapist who could help them with gait mechanics or learning to walk in the AFOs, that would be really wonderful. Denise, I don't know if you want to speak to that.
Yeah, well, what I have seen in, well, not only in Esperança, but the missions that already did that, few of them got physical therapy, and they got one person that did that, but that foundation covered that. Now with Esperança is something that maybe we can talk about it, because there are not many patients that had they had to have like physical therapy, but as Dr. Spahn said, if it's possible to have the physical therapy, is something that just we can work it out with all of you, and we can just make it happen. It won't be a problem. I think just we can have all the tools and to make it happen.
Yeah, I think there's been a few babies, a few kids that we met specifically that had cerebral palsy who really we didn't have a surgery for them, but something like physical therapy would be of great benefit for them. So, you know, even though we're not operating on everyone that we see in clinic, we are getting a lot of these kids over to get braces. We're getting a lot of them over for other sort of things that they wouldn't have access to unless they did come see us.
Right. Thank you both for that. I think that that's something that we have been pretty good at in the past at Esperança, is iterating after every trip. What can we do better? What other resources can we add? What other barriers have we found that we need to remove and to increase access for families, right? So I think this is a great conversation that we're starting, that, you know, if we had a physical therapist available, what else would the surgeons be able to do? And what other opportunities would that bring to us? And, you know, for us, we'd love to help with that and remove those barriers. So it's just a matter of continuing getting the support from our wonderful donors and viewers that are with us right now. Thank you all so much for staying with us and for supporting the work, because this is the outcome of it, right? We get these incredible experiences and life-changing surgeries for the families and children that need it most. So thank you all for watching us today. Thank you, Dr. Spahn. Thank you, Denise, so much for joining us. This has been a pleasure. What a treat to get us through the week.
Oh, thanks for having me, and good to see you again.
Yes, you too.